Welcome to the webinar, April 19th. It's a beautiful day here in Cincinnati. Spring has sprung, and Tim Condon's on the line. He will be going over part 2 of the Ambetter presentation. Let's roll through my slides first, and then I'll toss it to Tim. You know the drill. If you got a question, put it in the question box. I'm going to monitor those throughout the presentation, so we're going to jump in if you've got a question about something. I'll ask Tim, and any question you might have related to Ambetter or the individual market in general, just let us know. Here we are, the dynamic duo of the individual market. My colleague Eric Pouncey Jr. is also on the line, and we're broker specialists when it comes to individual under 65 matters. And follow us on social media and check out the Monday Minute for the latest on industry updates. There's our information. Give us a shout. Earn up to $7,000 with our incentive program. Earn more when you sell more for all group and new individual sales between January 1st of 2023 and December 31st of 2023. And you can earn points, bringing you closer to a $7,000 cash prize. Register today. It's on our website. Earn $250 with Cornerstone's Refer an Agent program. All you need to do is submit the referral. We'll track and monitor your referral over the next 6 months. And then once your referral submits business, once your referred client refers business, we'll give you $250. And check it out on our website. Let's toss things to our colleague Tim Condon with Ambetter. Today will be short and sweet. And Tim, you on the line?
Yeah, I'm here.
Okay.
Geoff, hopefully. Good morning, everybody. Thank you very much for the opportunity to talk to you this morning. Hopefully everything is going well for everyone today. I know that you guys sat through a presentation last week on Ambetter. I'm going to kind of touch some highlights on our company and what's going on in our industry. By all means, ask any kind of questions you'd like. That's kind of what here. I'm hoping to have a little dialogue going back and forth. And then afterwards, maybe I can show you our website and show you some of the tools that we have. So to get started, big picture, Ambetter, just a quick highlight. We were established in 2013. We were offered by the Centene Corporation and Buckeye Health in the state of Ohio. Centene is a Fortune 26 company. We have over 35 plus years in the managed care industry. We had a really extraordinarily large, great response during this past open enrollment, and we now have over 3.4 million members. We're the #1 carrier in the marketplace nationally and have been for the past 5 years in a row. Because we had such a good open enrollment, it's actually 1 in 5 ACA shoppers now choose Ambetter. We are a certified qualified health plan issuer on the health insurance marketplace, and all of our plans are designed to deliver high quality, locally based healthcare to our membership. And what that means is all of our membership divisions are all located in each cities in Ohio. Ours is in Columbus.
Hey, Tim, I want to jump in here. We don't see your slide just yet.
Which I don't know.
Way to see your screen.
You can't see my screen. Okay, I don't know what to do to go backwards.
Let me take it back real quick, and maybe it'll activate.
Yeah, take it back.
Okay.
Start it over. Sorry, everybody.
That's all right. That's all right. You can see my screen now.
Yeah, I see the
Ambetter logo. Yeah.
Yeah, the Ambetter logo. Okay.
Let's make it. Send it to your screen. And
are you taking it to my screen? Okay.
Yeah, you should get a little pop-up button.
Yep. Okay.
There we go. Perfect.
Perfect. Okay. Sorry.
Gas. No worries.
Take 2. Okay. Apologize, people. So again, this was just to highlight. Again, 2013. We're a Centene Corporation, 26 years, and we're a Fortune 26 company with over 35 years. In the managed care industry, we have 3.4 million members. We're the #1 carrier in the marketplace, have been for the past 5 years in a row. 1 in 5 shoppers in the ACA are Ambetter clients. For 2023, the big picture, most of the stuff has already passed, but open enrollment ended on January 15th. Our enhanced tax credits from the American Rescue Plan continue throughout the entire 2023. Ambetter has a $0 copay for Teladoc for virtual urgent care visits, including mental and behavioral health on most plans. It's a $0 after deductible for some of the plans, including the HSA plans. For 2023, as we all know, CMS introduced standardized plans. Ambetter, as we do every year, expanded. Ambetter Virtual Access has been added into 9 new states listed there: Florida, Georgia, Indiana, Kansas, Missouri, North Carolina, Nebraska, New Hampshire, and Ohio. Ambetter Core, we entered into a new state for this year, which was Alabama. And we added our new product called the Ambetter Select product, which is just kind of a closed network, added into 2 states, Tennessee and Arizona. And then our off-exchange plans will be offered in all the different states listed below there. So in many of our states, essentially. Okay, and for 2023, in Ohio, we expanded into Ashland County. So one of the things that's our main, one of the main focuses going on right now is the Medicaid redetermination. This is where CMS and the states are going to take a look at the income levels of all of their members and all the different programs and determine to make sure that they're in the correct program. There will definitely be some switching going back and forth. Each state has a different time frame. As you can see here, as you go down the list, there's a variety of different starting. Essentially, they're all going on right now. For Ohio specifically, is scheduled to initiate the redetermination process in May 2023. The members by now have already received letters on this. As a company, Ambetter has reached out to, we sell in all different kinds of varieties of arenas. So we've reached out to all of our affected membership in this redetermination and just suggested to them that, this is what's going on. Please contact your brokers or us directly if you have any questions. And once the determination is set as to where you're going to go and which program you're going to be into, please contact us. We'll be more than happy to describe whatever you need to do in terms of getting products. So, but there's all kinds of marketing going on, all kinds of information going on, flowing back and forth between the CMS and the states and the public and carriers for that matter. So everyone should be aware of this at this point in time, I would think, in terms of memberships and stuff. One of the great things about Ambetter is we have contacts with CMS, and so we get lots of good information coming out that generally is not out to the public yet. I don't know if any of you are aware of this, but the president of our company, Kevin Coonahan, used to be the president of CMS for the first 6 years of its existence. So he's got real good, he still has contacts at CMS and gets really good insights. So currently, these are some proposals that CMS is proposing for changes for 2023. The first one is, and I try to grab, when they send these out, there is a list of about 5 pages worth of information they're trying to disseminate. I try to grab what I thought would be appropriate for this audience. So the first subject is they're going to try to limit the number of non-standardized plans options that issuers may offer in the exchange to 2 non-standard plans options per product type or metal level, so to speak. So that's good news for every broker, in that the carriers will now not be able to, if this goes through, what that will mean is that in each in each metal tier there will be a limited number of options. That will be good for brokers in terms of trying to learn new products. It will be bad for members in that these different products are geared towards specific membership populations. And so because it's going to have to be standardized, there won't be some of the advantages that will be taken away from them, essentially. In terms of agents and brokers, CMS proposes to require that all agents and brokers assisting with enrollments through FFEs and SBEs, including updating an existing application, to document the receipt of consent from the consumer or authorized representative seeking assistance or prior to providing assistance. CMS provides context requirements for this documentation and a 10-year maintenance requirement. If any of you guys are selling Medicare, you'll know that this has been coming down the pike for the past year and a half. It's starting to bleed into the marketplace arena. I think this is the future, that they're going to be requiring documentation of receipt of consent moving forward. more and more they're starting to get into the areas of making brokers record conversations. So I think this is just the wave of the future of how we're going to have to operate. In terms of enrollment assisters, CMS proposes to allow navigators and non-navigators assistance personnel and certified application counselors to do door-to-door or use unsolicited means of direct contact to help enrollment assistance to consumers. So, this is a good thing in that they'll allow the navigators to talk to the more to the public and go out and educate the public on our products and, what goes on in the marketplace. So it hopefully should turn out to be a good thing. And then they also announced they're going to be increasing their cost sharing limitations for 2024. For the CMS proposed the maximum limitation on cost sharing to be $94.50. Last year was $9,100 for self coverage, and for $18,900, which last year was $18,200 for other than self coverage. So that's just kind of some of the high things. There's a bunch of stuff going on. Every year they propose a bunch of changes, and about 2 or 3 of them get enacted. These were the ones that I thought would impact all of us here on this conversation. So that's why I want to just make you guys aware. So, okay, Ambetter Plus, back to Ambetter. Ambetter Plus Brokers is a strong partnership for growth. We pay competitive commissions on both new and renewals. We have a pretty good broker portal tool with customizable sales materials and training tools. If any of you guys would like to see a product training in every one of your broker portals, there is a taped copy of the product training for each year for all of our states in all of your broker portals that you can access anytime you'd like to. In addition to that, there's all kinds of marketing materials that you guys can take down and customize. A lot of different PDFs that you can put your information on and send out to your clientele and stuff. We also give you a dedicated broker sales and support team, which helps you to get quick solutions to your membership. Ambetter realized that the lifeblood of our company is brokers. Currently, we're somewhere between 61 to 65% of all of our membership comes through the broker channel. So we understand that you guys are the lifeblood and try to work as best we can with everyone to try to make sure you guys are happy and getting all the tools and all the information you need. So we're here to help is basically the role of myself and all my team. Okay, this is just a graphical representation of where we're at. As you can see, we're all over pretty much over the map. We are, for 2023, we expanded, like I said, into Alabama. For 2024, we're looking to expand into a couple other states. One will be on the East Coast and one will be in the Midwest. So there'll be more to come once we had those finalized. Here in Ohio, as you can see, here's all the counties we were in. For 2023, we went into Ashland County this year. We're hoping to go statewide sooner than later, and that's the ultimate plan. It's just making sure that we have network adequacy in these counties that we're not in yet. That's kind of what we're doing. So, last week, you guys all kind of went through the featured plans. I don't want to spend too much time on this unless you guys would like me to. I'm just going to kind of go through, highlight. Obviously, all of our plans include the 10 essential benefits for all that all marketplace plans do. But in addition to that, we have some really good programs that set us apart from all the rest of our carriers that we compete with. We have a My Health Pays and Rewards program, whereby all of your members can earn up to $500 annually by just completing some surveys and doing some programs, and we'll get into that in a little bit. We have medical management programs where anyone who has chronic illnesses or needs assistance in managing their medical issues, we have a management team that can help them with that. Like we said before, we have a $0 copay for virtual urgent care visits, including mental and behavioral health on most plans. There's no exclusions for any pre-existing conditions. And then again, we have a local health plan staff to assist our membership. So as always, we have a bronze, silver, and gold plan portfolio. If your member is these are our standard plans. If your member's in our standard plans, when you go to our website to look up for a doctor, you just want to make sure they're in the correct network, and that's in our bronze, silver, and gold plan. In terms of our portfolio specifically, we have a virtual access portfolio. These plans were designed for virtual primary care experience. Members can download an app and select their doctor. The plan is not designed for members who would like a traditional brick and mortar PCP, but members on this plan should not expect to keep their current brick and mortar plans, current current brick and mortar PCP. In other words, we have doctors that will sign up for a PCP virtual visits. Some are comfortable with this, some are not. So you need to check the network on our website. You have unlimited $0 business with a PCP. Let's see, referrals are not required. There's a 24/7 virtual urgent care with $0 cost. Members would have access to $0 lab testing. Medications can be prescribed in central local pharmacy over the phone. There is no vision or dental on these plans, and reciprocity there's reciprocity to the core network on these plans. So here's the plans we had. You can see we had 3 gold plans, we had 5 silver plans, we had 4 bronze plans, and then we had to include our quote-unquote CMS standard plans, which was a gold plan and a standard silver plan. Shondell last week ran through all these in detail. If anybody has any questions, I would be more than happy to go into it. I'm not going to go through these in things. I'm just going to kind of give you guys a chance to look at, the differences. Again, complete silver, our focus silver plan, our enhanced silver plan. And essentially with all these plans, as you guys all know, all these comes down to our, they're manipulating different levels to make it, easier for people depending on what their, preferences are. You either have a larger deductible, a different max out of pocket, or, the different copays and charges and stuff. And that's all, tied into the premiums, the monthly premiums on the product. So they just try to tweak each one depends on how people want to pay for their medical costs is all. So here in our bronze plan, there's a clear bronze for 2023. As you can see, it had a deductible of $8,600 and a max out of pocket of $8,600. So there's a lot of different kinds of ways to change things. So all these plans are in detail on our website. Any tool that you guys would like to see or any kind of information you're going to need is on our website as well, or in your Ambetter broker portal. We have all this stuff online. Ambetter is a very online company. Everything you need to access, you can grab either, again, via our website or our broker portal. And then, of course, we have our Ambetter broker sales team is here to help you guys as well. For our core plans, we have our adult vision add-on. Basically, what it comes down to is you get a routine eye exam and then either a pair of glasses or contacts, whichever you prefer, per year. And then in addition to that, we have, again, this is just highlighting that, sorry. And then we have a dental add-on as well for 19 years and older. It's $1,000 per covered person per calendar year. For routine and cleanings and exams, $0 copay. For basic dental and major dental, it's at a 50% coinsurance. Most importantly, for our pet dental programs, there's no waiting period. So the moment you sign up one of your clients to a adult dental and vision add-on, they can start utilizing these services right away. Okay. We also sell off-exchange plans. These are affordable. Basically, they're ideal for consumers who don't qualify for subsidies. The premiums are slightly less than the on-exchange plans. It's the same provider network and formulary. You can sign these folks up through your broker portal or go by going to our website at www.ambetterhealth.com. Over in the right here are the different states that we offer the off-exchange plans. There's 2 silver plans and 2 gold level plans.
Hey, Tim,
very similar to.
Can I jump
Sorry,
in
go
here
ahead.
with a question?
Yep.
Can I jump in here with a question?
Yes.
Okay, if you have a couple on a plan that has earned money on the healthy rewards, but one member goes to Medicare, does that spouse lose all that money?
Not as far as I know. It still stays in the account until you spend it. Basically, and we'll get into this in a second when we get into. I'm going to get into my health pays in a few minutes. And
Okay.
I'll show you the details. But essentially, what happens, just to answer your question, your member can get what is you'll see in the slide is a credit card. So basically, they'll have a prepaid credit card they can go use on whatever. So if you just I would suggest, it's not like it's going to go away, but I would suggest if you have a member who is moving into a different plan, have them just make sure that they have, they go out and download all their points onto their credit card, and then from there they can do whatever they want with it, right? Obviously.
Okay, and just to add to that, is there reciprocity from state to state on the core bronze, silver, and gold plans?
Yes, reciprocity. That's a great question, Jeff. Thanks for asking that. as we went through these plans a little bit, and I did it kind of quick, so I apologize for that. We have what we call basically our core plans, our virtual plans, and our select plans. In our core plans, if any of your members are in any of our states that I showed you previously in the 28 states we're in, if they're on vacations, for example, and they happen to need to see a provider for whatever reason, they can go to an Ambetter in-network provider in any of the states we are in. They have to be in our core plan, and as long as they're in our core plan, they can go to any provider in any of our states. So if they're on vacation and something happens and somebody comes down with a cold or whatever, they can run over to the urgent care that's in our network and utilize the provider there by just showing them their membership card from Ohio or whatever state they're in.
Okay,
this is a particularly attractive feature for folks like ourselves. I'm in Chicago. You guys are in Ohio. People get tired of the snow and like to go down to southern warmer climates. This is a very attractive feature for some of our older folks that can take advantage of that and go down and are living in, for say a month or so in say Florida or Georgia or Alabama or something.
Okay, and to add to that, is this only on the core plans and not on the virtual plans?
The virtual plans you can here. It actually went into this, and I'll go back there and let's.
I know we're all over the place, but this is good.
That's okay.
This is good.
This is the whole point, right? We're here to sit here.
That's right.
Okay.
That's right.
So we're here to try to answer questions. So I'm reading through it as fast as I can. In here, I actually talked about it somewhere. I'm just trying to find it for you guys.
Not the expert. That's what it is.
Down the bottom, reciprocity to core Ambetter network on the last bullet point.
Okay. All right.
So yes is the answer. So in other words, they can use, if you have a virtual, they can use, they have to stay in the virtual, but they could use virtual.
All right.
Okay.
Lead on. Thank you.
Great question. And again, please, I want to try to make this interactive. So if any of you guys have any questions whatsoever, stop me at any point. I love doing stuff like this. I can run through a slide deck anytime and be bored, but it'd be great if you guys have some questions or want to talk about anything. So, okay, so we were last we left off, we were talking about our office change plans. Again, this is just for consumers that are not going to qualify for a subsidy. You might want to take a look at these. Are a little less expensive, and when I say little, we're talking a couple of dollars essentially. It's the same kind of features and plans, same network that our core plans have as well. So now I just want to kind of just highlight some of the things that differentiate us from our competition. Here's our website. Again, like we talked about, if you need anything, you can go to our website. It's just www.ambetterhealth.com. It's one of the things we have on our website is a member login whereby your member can create a portal. They just come in here, log in, create a password, put in the policies, they go in, and there's all kinds of good stuff that your members can access. You see across the top, they can look at the doctors, pharmacies, payments, rewards, activity, usage, all kinds of good things. They can sign up for PCPs, do all kinds of different stuff. To look up for a doctor, they would click on the link in their portal or bring them to our website, which is our guide at ambetterhealth.com. You would just come in, you log in, it'll do a search. Say, do you have a plan? No, I don't have a plan. What county or what state you're going to be in? You put in there, and then you come here and you select either the select network, the value network, our virtual network, or our bronze, silver, gold network. So this is an important point. For all your members, 90 to 95% of your members will probably end up in a bronze, silver, or gold core plan. When they're looking for a doctor, make sure they select the bronze, silver, gold network so that they're in the right network when they're trying to find their doctor. Once they get there, they'll come up here. You just put in your name for the doctor, and then to the right, you just put in the city, county, or zip code you're looking for, and you hit search, and away you go. Again, you can edit and just change this if you want to change the state or change the year, change what kind of plan you're in, that kind of thing. So once you hit enter and you put in your doctor's name, it'll show you that you're in the right bronze, silver, gold network, and then down here shows all the providers, got all the details, the addresses, tells you they're accepting new patients, tells you they're offering virtual visits or not. And then if you want to get more detail, if any of the members want to get more details on the specific doctor, they can click on view profile. It gives them all the different details of the office, the languages they speak, the hospitals they're associated, and then a more detailed map for them to see where exists the specific locations. Okay. And then also, they can go in and look at doctors. Again, it brings them to, they just click on the link, it'll bring them out here to our website, and then it brings them out here. You can do the same thing by just going to our website and just click on Form Members. As you can see, a drop-down menu comes down. There's all kinds of different options here. They can make a payment. They can find a doctor. They can look up drugs. They can figure out different ways to pay. To the right is our member login, where they can go log in and create a member portal, which is what we talked about. This is just showing our preferred drug list. If you went to our website and you went www.ambetterhealth.com and clicked on drug coverage, it would bring you to this. You just go over and click here. And on our website, I apologize, this is obviously an old slide deck. We have our 2023 prescription drug list on our website. They just come here. If you hit Control F, Control Alt F, it will bring up a little search box. And you just type in the name of your drug, it'll bring you right to it and tell you exactly how it's covered. And then again, they can go in here and take a look at the pharmacies that are available and all kinds of different stuff. Payments, there's a lot of different ways they can make payments. They click on here and make a payment. They can set up auto pay. They can do, they can pay via mail. They can do it on the phone. They can do it through our website. So a variety of different options. They can set up auto pay or not. And again, this is all, here's a way to show an example how you can do it on our website. You just click like this, you put in your policy number, your date, your zip code, and away you go. So, as we all know, policies are not active until the first month's premium is received. They just want to let you know, again, these are just highlighting the different ways they can pay. And so, if they go in the member portal, they can set up payment settings on their auto pay and other things. Okay, post applications, members get a letter reminding them to make a payment. Once the payment's received, they get their ID and welcome packet. And again, you want to encourage your members to slide into a member portal on our website or create a member portal on our website just so they can access all the different things we just talked about. In addition to that, here's a picture of the different ID cards we have. The good news about this is that you can see on the right-hand side, on the left side of the card itself, it'll show you whether you're in the Select network, the virtual access network, the value network, and then the core network is the one that doesn't have any highlight on the left-hand side of the card itself. So all your members should be receiving those in time. And then here we get into our rewards programs. And this is kind of something that Ambetter was the first company to do this. And we started this over 4 or 5 years ago, I think. Members can add, again, as we talked about, members can earn up to $500 in rewards through our My Health Pays program. They earn points by completing specific health screenings and participating in fun and easy activities. There are surveys if they do have any kind of exams, they do any immunizations, screenings, or any of that kind of stuff. They all get rewards and points for that. The whole focus of the program is to get members focused on eating right, moving more, being well, and saving smart. They can use the points to shop in our online store, or they can convert their points into pay a premium and other healthcare costs by getting Ambetter Health. They'll get a Visa prepaid card. So they can use this prepaid card to pay for their monthly premiums. They can use it for their doctor copays, their deductibles, their co-insurance. But in addition to that, they can pay their monthly bills, their cell phone bill, their transportation, education, rent. They can use it for a whole variety of different kinds of stuff. So it's all a great thing, and we do definitely have members that have a $0 premium and earn up to $500, so they're actually earning $500 a year by having health insurance. What a wonderful world we live in. So again, this just kind of highlights the different ways they can, get points. For example, if they Suja on board, you can get 500 points right away by, just signing up. Just some quick little facts that we're kind of proud of. My Health Pays year to date, nearly 300,000 members have activated their My Health Pays account. We have collected, My Health Pays members have collectively earned over $24 million in rewards in these past 4 years. And then, as we all know, members who are getting paid money are more than likely to renew with our company. So it's a win-win-win situation for everyone. $24 million is a pretty large number. If you think about it, when you come down to paying a monthly premium of about $10 to $20 a month, it'll cover it. So it's a wonderful program for some folks that can use it. In addition to that, we also have we want to try to keep our members as healthy as possible. So we have gym memberships. They can get discounts on home gym equipment. They can take digital fitness classes. There's healthy eating services and discounts on local gym memberships and stuff. All this your members can take advantage of by simply logging in, creating a portal, creating a member portal, and then taking advantage of the rewards program. Okay. Other than that, next we as many companies as as we all lived through the pandemic, teledoc became the critical service that everyone wanted. It's great for it was 24-hour emergency system. It's great for 24-hour help for non-emergency situations. It lets people connect to experts regardless of their physical locations. You avoid long wait times. It reduces the cost of healthcare. It's great for rural areas, and there's a $0 copay for virtual urgent care visits, including mental and behavioral health. Great service. We also, as we talked about earlier, have a disease management service. We use WellFrame. It helps all of our membership stay on track with their health and wellness. It's all kinds of good stuff. Tools that they can use, digital tools that help them keep track of different medical issues that they might run into. It gives them clinical alerts and reminders to make sure that they're staying on track and doing their programs. And you can integrate biometric devices such as a glucometer or high blood pressure monitor. Excuse me, I'm having a tough time talking today. Sorry. Okay. Members, again, these are just a variety of different things. Members are eligible for services that are not limited to frequent inpatient admissions and ER visits, pregnancy through delivery and postpartum care, and members experiencing comorbidities, with serious medical conditions. Okay, one of the great tools that we give everybody is access to a broker portal. This is our broker sales support team. The number's down there, and we'll go through this at the end. It's a dedicated help desk team for brokers only. You guys call that thing. They're here to help you guys, just like us and the sales team are here to help you as well. So in your broker portal, there's all kinds of good stuff. It will show you your active members. They have different dashboards, your active members, your delinquencies, your unpaid binders. Up across the top are a bunch of other things you can click on. For the principal of an agency, they can look at commissions. None of the sub-producers can look at commissions. There's also different ways you can do, look at your clients, and different buttons you can go to do different things, such as make payments, roll a client, or find a provider, right? These will bring you right out to their website and take you right to them. Again, these are the dashboards that are showing you the different, what your clientele are doing. Here inside here are all your different policies. You can do this by different categories. You can do all your policies. You can do all your active policies. You can do your delinquents, all different kinds of things by just simply clicking up on the top there. On the right-hand button, to the right is a download arrow. If you click on that download arrow, all your client information will go down to a spreadsheet that's very easy to read and allow you guys to track and keep track of what's going on with all your clients. And you can, obviously sort the Excel spreadsheet into different ways and, see like paid through dates or, active versus non-active, all different kinds of good stuff. So, okay. And then again, we just talked about the different ways, once you click on it, you can actually go from this and, if you're in this screen where you're looking at your policies, you can click on one and actually download it, get all the information you need, see what's going on with them, see what the monthly payments are. You could actually, again, go up to the top and make a payment if you need to. You do all kinds of different good stuff. So, real good active tool. You can go, again, request ID cards, do all kinds of different things. It's basically a way for you guys to track all your membership with Ambetter, see what their status is. You can see who's, again, you can sort it through who's paid through dates. You can do it through, members' responsibilities, see what their payments are. So anything that you or your members going to need on information in terms of your membership will be right here. Okay, and then obviously it'll give you a status if there if there's any kind of payment issues or whatever. It'll highlight that for you as well to let you know that this member needs to do something. Okay, and then again, all you have to do is go up there to the quick pay button, click on that, put in the policy number, put the last name, put the zip code, and away you go, and you can make a payment. Okay, and then again, this is just showing you again another way. This is your unpaid. This is a listing of all of your unpaid. So you can download that in a spreadsheet and see who still needs to make a binder payment or who still needs to make payments and stuff. Again, you just go about there and you can click on it and make a quick pay. One of the real good things about this is our resources tab, and this is something that you guys should all take advantage of. As you can see, we have 3 different folders here. One is the marketing materials, one is our training materials, and one is our forums. And I'm just going to kind of talk about them. In our marketing materials, if you click onto this thing, into the box, it's listed by state. In each state, we have all of our current brochures that you guys can take down and customize by just, they're just PDFs, and all you got to do is just take an Adobe Reader, and you can literally click on and put in your name, your agency name, your address, your phone numbers, whatever little message you want to put in. So all kinds of good brochures. There's social media stuff that you guys can take advantage in there. So all kinds of good marketing materials that you should definitely be taking advantage, free for you to use. In our training materials folder, we have a tape copy. Every open enrollment, we do a product presentation in each one of our states, and we do it multiple times. And when we get done with that, we tape these presentations and we put them in your broker portal. So if you just come here, let's just say you start mid-season, you come on board, you start selling marketplace plans in, say, June, all you got to do is come over here to our training materials folder, click on that, find your state, click on the presentation, and sit there and watch it, and we'll give you all the information you need. And last but certainly not least, on the right is our forms folder, and in there is every form that your member is going to need to work with Ambetter is right there. You can just click on that, download the form, and send it right to your member and fill it out for them if you need to. So, okay. So please, by all means, take advantage of this kind of stuff. It's really good information inside these that you guys should definitely be using. Okay, one other thing too, while you're in your broker portal. Oh, sorry, go ahead, Jeff.
Oh no, doing great,
Okay.
and we're gonna wrap things up here a little bit. I got a question or two, and then.
Okay, I'll wrap this up in 2 seconds. Last but not least, in your broker portal is your profile. That will show you what your appointments are with Ambetter, show you specifically what your contract status is, and all that kind of stuff. So if you ever have any questions on where you stand in terms of appointments with Ambetter, what states you're appointed in, what your contract status is, anything, it's all right here in your own profile. Okay? And then these are just our top reasons to sell Ambetter. First and foremost, we are again, we're number 26 on the Fortune 500 list, which is good for you guys, and that we're a financially stable company, not going anywhere. We've been around in the ACA since the beginning of the ACA. We never pull out of counties. We never pull out of states. There's not a lot of our competition that can say that. We've been around since the beginning. We are a financially stable, well-respected company in this arena. That a lot of our membership, we have the most membership of any carrier in this arena, and there's a reason for that, and that's just kind of all the different programs we have and professionalism we try to treat every one of our members and brokers with. So, how's that? And then just real quick, I wanted to just touch base. We added this past open enrollment. We added University Hospital System in that would be Northeast Ohio, essentially. So there's some of the different hospital physical locations themselves. If you go, we added their entire network, all their PCPs, all their specialists, everything, lock, stock, and barrel. We're always trying to expand our network to get better. We're looking to try to expand some network additions in the Columbus area. We'll see how that works out. But again, if you guys have any suggestions or any major provider, anything that would be critical to your business or anything that you think would attract more membership for us, please, by all means, let us know, and we'll be more happy to try to go after that provider. Geoff, I can go.
Here. Definitely. Yeah. Let's just a quick question. Circling back to this reciprocity topic, I think it's one of the things that sets you guys apart.
Sure.
And we share this with our agents, but now for a client, will they find that in some of the company literature?
No, and there is a reason for that. As we all know, each state has, when the health insurance carrier goes into a state, they have different licenses. So some states are HMOs, some are PPOs. It just depends on which states are concerned. And as a result of that, we can't publish the fact that our reciprocity goes across all state lines. They're not really happy about that. As far as Ambetter is concerned, you can use any of our network providers in any of our states, but we're in different states under different licenses, so you cannot publish that fact. Is the unfortunate situation. But we tell all of our brokers, we tell all of our members, we describe this every time we have any kind of meetings and everything we can do, and try to get the word out as much as possible as we can. As we all know in this world, CMS controls everything in terms of marketing and information you can put on marketing pieces. Unfortunately, this is something we cannot put on a marketing piece.
Oh,
Great
interesting. I
question,
did
John.
not know that. That's a great question.
Yeah,
Yeah.
yeah, that's what that
So,
is.
and
If it was up to us, if it was up to us, we'd put it on billboards all across the country, right? Because
yeah.
nobody else is, but so we have to disseminate this as best we can without putting it onto a marketing piece, partially.
Okay. Great, Tim. And I want to point out that this recording will be shared with everybody later today or first thing tomorrow. What's more, you'll be able to find this recording and more out on our website in the resource page. And there's the sales team for Ambetter. And
Yeah, so just if I could just jump in real quick, I just got to mention real fast. Here's our sales team. If you guys have any questions or need anything, please by all means give us a call. Here's our email addresses and contact information. I mentioned earlier we have a broker support team as well. Here's their contact information as well. The 855-700-7985 option number 2. That's their direct line. Ambetterbrokers@centene.com is their direct email. And then for the sales team, we have a general sales number. That's 855-700-7985, option number 3. And there's our direct Ambetter sales email address as well. So
fantastic. Thank you so much, Tim.
Thanks.
Any last
Thanks,
thoughts?
everybody. I'm sorry?
Any final thoughts?
No, again, thanks everybody for your time. Really appreciate it. Know you're very busy. Would love to work with you guys. Always, here to help with any questions you guys might have. Anything that comes up, our team is here to help. Would love to work with you. And again, thanks very much for your time.
Thank you, Tim. Everybody, have a great day.
Take care.